This is an example of a normal situation where when the teeth are together, the jaw joint is in a correct position. If you'll notice, this portion right here is called the condyle, or the upper part of the lower jaw. This portion right here is the temporal bone, or the bone with which the lower jaw articulates. The structure in between, the yellow structure, is the disc. The disc acts as a shock absorber between the two bones. Notice also that there is a space behind the condyle and in front of the ear. This is a normal situation. Normal function looks like this. There's a rotation, then there's a translation. And notice that the disc stays between the two bones through the whole range of motion. Normally a patient should be able to fit approximately 3 finger widths between their top and bottom front teeth. When the teeth are together, also notice that the jaw does not travel up and back and that the space is maintained between the condyle and the ear. That's normal. I'll now show you abnormal. In an abnormal situation, when the teeth are together, which a dentist may look in your mouth and say, your teeth are straight, they're fine. However, what they're not looking at is the other side of the equation, which we can see using our 3D technology. In this situation, notice that there is no space behind the condyle and no space in front of the ear. Normally, there are nerves and blood vessels passing in that space, and in this situation, every time that the teeth come together, which is about 2,000 times a day, every time that one swallows, the teeth come together. When the teeth come together, this area is compressed. Notice also that the disc, the yellow structure, is no longer between the two bones. And oftentimes what will happen, as this particular patient opens, they will get a click onto the disc, then they may be able to open. And then as they close, this is where the jaw wants to stop, but notice the teeth do not fit together, and the jaw continues back to stability where the teeth meet. Click off the disc. The American Dental Association has done several studies and estimated between 2/3 and 3/4 of the entire American population suffers at least one or more symptoms of TMJ disorder. The next scenario involves complete displacement of the jaw joint or having the disc completely displaced. You'll know you have this problem if you can't open your mouth very wide or you have trouble getting something into your mouth when you're eating. In this situation, when the patient tries to open, they can't open very wide because the jaw is stuck. The disc acts like a door wedge in between the condyle and the temporal bone, and the patient's not able to open any further. As a result, all of the muscles surrounding the joint go into spasm, which causes more pain because the jaw is actually trying to prevent further damage from occurring. This is called muscle splinting. Our solution for this problem, as the jaw is positioned too far up and back, non-surgically, we reposition the jaw with this little piece, which is an oral appliance. That's what it represents. We place that between the teeth, typically worn over the lower teeth, to properly reestablish the position of the TM joint. So now when the patient opens, they have a rotation, translation, and as they close, they cannot travel too far up and back to compress those tissues. This treatment typically takes between 6 and 12 months for this tissue to heal and rehabilitate, after which time we address the proper jaw position by changing the form of the teeth, either with orthodontics or by placing prosthetic appliances over the teeth, such as crowns, onlays, composites, partial dentures. It depends on what the patient's needs are.